So today I wanted to talk to those of you whose affected hand after stroke is starting to feel really tight, stiff, or like it wants to just stay closed all the time. This is can be very common after stroke. Now, for some of you, what you're experiencing may be caused by an increase in what we call muscle tone, while for others, it actually may be caused by what we call spasticity. The differences between the two usually aren't talked about that much, which can kind of make things confusing, especially since a lot of times, even in like rehab and medical worlds, the two terms are used kind of interchangeably, but they are actually different. Now, both tone and spasticity are caused and will vary in how they present depending on where in your brain your stroke happened, right? And the amount of damage that occurred to the tissues and nerves from the stroke, right? So let's just break down what tone and spasticity actually are, and more importantly, some things you can do to help manage it, all right? So let's just start with muscle tone. Muscle tone is something we all have, obviously. So healthy, normal muscle tone kind of gives a more, like we'd say, like a balanced amount of tension in our muscle tissues, which is what allows our muscles to create movement, right? Now, with muscle tone or tone, we start to get into trouble when the tone is excessively low or excessively high, or what we call increased tone, which happens after a stroke. Now, low tone is just like it sounds. It means like muscle tissues in your arm or leg or both have lost some or all of that tension in the muscle tissues. And on the more extreme end of the low tone is a type of low tone we call flaccidity. This would be when an arm or leg is just completely flaccid after stroke. There is a complete loss or absence of muscle tone in that limb. So your arm or leg may seem kind of limp or floppy, for lack of a better word. Now, high or increased tone on the other end of that scale is when there is just way too much tension in your muscle tissues after the stroke. So your arm and leg may feel excessively tight, rigid, or just really hard to move, right? And it increases over time. So becomes harder for you to straighten your joints in a normal way. And so sometimes a very common pattern you may see is what we would call like a flexor tone or flexor synergy pattern, when you see like your hand and wrist and elbow all want to flex and bend, and the arm and shoulder want to kind of, in what we say, internally rotate and move in towards the body. So it kind of looked like this. This is all brought on by increased tone. Okay. Now let's talk about spasticity. Spasticity is a specific type of increased tone where the tension again in the muscles is just it's extreme. It's like way overactive, and it tends to really increase or get worse when you try to bring about like a quick movement. So like if you were to grab your hand and quickly try to straighten your arm or pull it straight, it's like your elbow and bicep like are going to tighten, almost like they want to lock up in resistance to you trying to straighten your arm. This kind of spasticity is actually typically what you see when there is some type of neurological injury or damage that affects certain neurons. And we call them upper motor neurons. But I don't want you to get too bogged down by all the terms. Just know that spasticity isn't something you're actually just going to see after stroke. It can occur with other conditions too, like spinal cord injury, other brain injuries, and neurological conditions. Okay, that's a lot. So now we know what tone and spasticity are. The real question here is, what can you do about it, right? So here are the key pieces that I want you to know and take into action. Slow, gentle stretching, making sure that your muscle tissues are warmed up and ready before you stretch. And while you stretch, you need to be hyper focused on the movement as it's happening, so that your brain gets that opportunity to engage and make those connections between the brain, the nerves, and the muscles. Use weight bearing to help, we call it break up tone. Use weight bearing to help break up tone in your arm and hand. So for the arm and hand, that means getting as much of your weight as you can tolerate going through that hand and shoulder. You can do this sitting and pressing into a ball. You can do it standing and pressing your hand on a table. You can press your hand onto a wall, or if you're able to, you can get on all fours and get weight bearing through your arm that way. While using your body weight, you kind of shift and apply weight through that effective arm as you're able. Now, obviously, which weight bearing method you choose is hugely going to depend on your ability level and your ability to actually get yourself into these positions safely. So use assistance if needed, okay? Let's see what else. You can also use an air splint. I love using air splints. Use an air splint as a part of your stretching routine to get a good prolonged stretch. So for more than a minute or more, which can be really helpful for those that have that kind of flexor tone that was setting in that we already talked about. Because what you don't want to feel like you're arm wrestling yourself or like roughly forcing your arm and hand into these positions, because I mean, as I'm sure you already know, that that just doesn't work. But air splints are really great for this because as you slowly inflate the air splint, it will slowly straighten your arm to whatever extent your arm will allow and can tolerate safely. Okay. So just remember, everything needs to happen slowly in steps, and it should be pain free. So always listen to your body, never force it. Okay. Now, after stretching, the next critical piece is positioning. You do not want to put forth all that time and effort to stretch your arm and hand and then go back to poor positioning habits or just kind of ignore it for the rest of the day. So, what I mean by this is if your hand is fully closed and extremely tight at rest, you are going to want to use some form of splint or what we call like a web space preserver. This is your web space in your hand, to help keep your hand and web space partly open and ideally in some kind of neutral position so that it's not overly flexed or overly extended. There is mixed research on resting hand splints, but I do recommend them if for no other reason than to help protect the skin in your hand and to prevent hygiene issues, because you all know moisture and lack of airflow to an area is never going to yield anything pleasant. I mean, I've seen people whose nails were like cutting into the skin on their palm. They develop rashes, skin breakdown, bad smells. Like, you know, you get what I'm saying. So, small towel rolls, ball splints, resting hand splints, anti spasticity splints can all be good options for helping you position your hand when you're not using it. So when you're sleeping or going to be inactive for long periods of time, be sure your hand and arm are positioned as neutrally as possible. Pillow splints are another one. They can be really great for reducing that extreme elbow flexion from that flexor tone again we talked about while you're sleeping, because it's soft. So use pillows to kind of keep your affected arm slightly away from your body so it's not so internally rotated. Okay. And then find some other method for your hand, another splint. And just always make sure to check your skin after wearing a splint for an hour or two. Make sure there are no red areas, nothing's rubbing or causing any skin breakdown. And be sure to consult with a therapist if you're still getting therapy services, or check with your primary care doctor to see about getting a referral for some additional services. Now, lastly, for some of you, your tone or your spasticity may become so severe, so painful that actually may be time to start talking to your doctor or your rehab team to discuss some other more medical treatments like medications, injections, pumps that can sometimes help in these situations. Okay. Oh, and be sure to check out my other videos. I try to show you as many different options for weight bearing as I can and for stretching and things like that, like I mentioned earlier. And I do go into, I know I touched on it today, but I go into a lot more detail and demonstrate exactly how to do it in these other videos. Because again, all of these things, stretching, weight bearing, all have to work together, positioning, right? And be consistent in order for you to see the results that you really want, right? So please don't hesitate to reach out. Leave me a comment if you have any questions at all, or if you need any suggestions for anything that I touched on today. All right. And as always, I really hope this was helpful, and I will see you next time. If you found this video helpful, don't forget to subscribe for more DIY videos to help you along the way in your stroke recovery. Struggling at home? Have a question? Leave me a comment. I'm here to help.